Hello everyone. So today we will be continuing what we have started, a very important lecture, of course, and the book that's very famous. Also shows the surface markings or surface landmarks on the lungs and the pleura, the projection on the anterior and posterior chest walls, the position of the lower borders of the lungs varies as you breathe in and out, so their projection is usually a compromise, giving their position in mid-inspiration. The inferior extent of the parietal pleura is shown in the light blue. As you can see, they extend lower than the lungs. The apparent gap between the lower borders of the lungs and the pleura is a potential space. The costodiaphragmic recess, the space, is roughly 2 ribs wide at its greater extent. Observe also in the anterior view that the lungs and their covering pleura extend above the margin of the first rib into the lower neck. As the first rib cannot be palpated, the surface landmarks of these upward extensions are referred to the clavicle instead, the apex. Auscultation of the lungs to listen to the sound of air entering and leaving is an important diagnostic tool in the investigation of several respiratory diseases. Each lung is examined throughout by placing the stethoscope over each lobe of each lung in turn. If you have ever had a chest examination, you probably thought that your doctor was placing the stethoscope at random. They were not. They were making use of the surface landmarks and experience to examine the lungs thoroughly. Note that the upper and middle lobes can be auscultated most easily from the front, whereas the lower lobe is mostly accessible from the back. The apex of the lung projects about 2 centimeters above the medial third of the clavicle. The use of these surface landmarks in the lung examination is covered the thoracic wall and the diaphragm, the thoracic cage, thoracic muscles, and intercostal spaces. The thoracic cage is made up of skeletal elements that form the thoracic cage, or more commonly but less accurately the rib cage, and muscles that move the components of the thoracic cage relative to each other. For ventilation and postural movement, the thoracic cage is made up posteriorly by thoracic part of the vertebral column, laterally and inferiorly by ribs and costal cartilage, and by the sternum in anterior and mid-sternal area. The thoracic vertebral column is made up of 12 thoracic vertebrae and their intervertebral discs. The thoracic vertebrae are not arranged in a straight line, but are concave anteriorly. All vertebrae have the following general configurations: the heart-shaped body with 2 backward projections, the pedicles either side of the vertebrae foramen, The foramen forms the spinal canal with the foramen of other vertebrae. Note that the pedicles are slightly shallow above and strongly grooved below to form intervertebral foramen with adjacent vertebra for the passage of spinal nerves. Two stout transverse processes running laterally and slightly posteriorly. Two flat plates called laminae would join to form a long spinous processes. You can feel the tip of the spinous processes very easily under the skin in the midline of your back. Sinus processes, laminae, facet for rib tubercle, transverse process, vertebral foramen, roughened vertical area, body, superior auricular process, facet for rib tubercle, inferior auricular process, superior auricular process, transverse process, spinous process, pedicle, inferior auricular process, intervertebral foramen, intervertebral disc, half facet for ribs, superior auricular process. Superior and inferior auricular processes at the junction of the pedicles and laminae. In thoracic vertebrae, the superior facets are set vertically. In thoracic vertebrae, the superior facets are set vertically with the facets of the superior processes facing posterior lateral and those on the inferior processes anterior-medially. The relative movement of the vertebrae is thus mainly rotatory. The thoracic vertebrae are modified from this basic pattern to articulate with the ribs through several more articular facets as shown. They carry on each side, shown mostly clearly, a superior and inferior dermi facet, half facet, on each side of the body for the heads of two ribs in the costal of T2, T9, or the single complete facet for the head and one rib in the case of T1, 10, 12. Shown in figure, a facet near the tip of each transverse process for the tubercle of the rib, except 12 and 11. Vertebrae are separated from each other by intervertebral discs. Each intervertebral disc has an outer ring of fibrocartilage, the annulus fibrosus, which encloses the nucleus pulposus, an ovoid crenulation mass. The intervertebral discs are a shock-absorbing mechanism. Sudden downward facets will tend to compress the nucleus vertebrally, but the simultaneous lateral expansion will be resisted by the fibers of annulus. The slight degree of movement possible between adjacent vertebral bodies occurs by a rolling movement on the relatively incompressible nucleus, with the annulus being stretched on one side and compressed on the other. The effects of overload of intervertebral discs are described. Slipped disc. Sometimes forces generated are so great that the nucleus of the intervertebral disc herniates through the annulus. This is a slipped disc and is most usually in the lumbar region of the vertebral column. The herniated nucleus may compress the spinal cord and inhibit nerve transmission. The body would be paralyzed and anesthetic below the level of compression. More commonly, the herniated nucleus extrudes laterally and impinges on the spinal nerve that exists at the level of the disc, causing pain to radiate down the distribution of the nerve. With increasing age, the nucleus becomes thinner and less aqueous and is eventually converted to fibrocartilage. Some degree of mobility in the vertebral column is lost as these age changes occur. Ribs and costal cartilage. A typical rib has the following features shown from above and anteriorly. Most of the length of the rib is formed by the shaft, which is convex externally. The superior border is rounded, whereas the inferior border is sharp. These features are best seen. The sharp lower border is lateral edge of the costal groove on the medial surface. A shallow groove running along the lower border of the houses is the intercostal artery, vein, and nerve. The radius of the curvature of the shaft decreases at the angle seen best. In figure, observe the tubercle, a posterior projection, elevation just medial to the angle. It has a small facet which articulates with the transverse process of the vertebra. This feature is absent from rib 11 and 12. The stout neck connects the tubercle and the head, which carries superior and inferior facets that articulate with the bodies of the vertebrae as shown. Note that rib 1, 10, 11, 12 have only one facet. The first rib is very atypical. It is described for those who require such detail. Each rib is continuous anteriorly by a costal cartilage that articulates either directly or not with the sternum anteriorly. Angle lateral costotransverse ligament, medial costotransverse ligament, tubercle, neck, head, shafts. Superior facet, superior costotransverse ligament, inner vertebral disc, head, neck, tubercle, inferior border, superior border. Inferior facets. These articulates between ribs and vertebrae. Superior anterior view. And of course, thank you for listening to this lecture of this amazing series of Let's Read book.